Good afternoon. My name is Frederick Reinfrank, and I will be your host lecturer on today's topic. This is pneumonia vaccination. Why is it important? And it's a guide to clinical nurses. So this little lunch and learn is meant to be a little break time when the new student nurses are coming off the floor and they're taking a break. It's to provide a little insight in a little quick mini learning session for you to grow and use for either patient education or self-education. So let's get started. So the goals and objectives for today's lesson will be, the number one goal is that I would like for you to take away the value and the importance of vaccination in preventing disease. The objectives would be, by the end of this little 15-minute lunch and learn session, nursing students will be able to distinguish between normal and abnormal lung physiology. They'll be able to critically analyze signs and symptoms of pneumonia. They will recall two vaccination options that are most commonly used in the United States. And you'll be able to understand the relationship of pneumonia as a disease to genetics, environment, or lifestyle choices. So the course outline. Here's what you have to look forward to today. Module 1 will be a quick background of pneumonia. Module 2 will discuss some pathophysiology, signs and symptoms of pneumonia. Module 3, we will talk about the vaccine options for adults. And in Module 4, we'll discuss the lifestyle and environmental factors of pneumonia. And lastly, in Module 5, we're going to have a summative evaluation quiz to test your knowledge at the end. Okay, Module 1, background of pneumonia. Pneumonia is mostly caused by a bacteria, Streptococcus pneumoniae. There are other causes of pneumonia, but this is the most common. Pneumonia is still one of the most common causes of sepsis and infectious disease deaths in the United States, with mortality rate of between 30 and 40%. It is estimated that 150,000 cases of pneumonia kill at least 3,600 people in the United States yearly. So, on to Module 2, pathophysiology and signs and symptoms of pneumonia. So, in this little diagram, you can see the signs and symptoms of pneumonia. They tend to be high fever, chills, clammy skin, even a bluish tone because of decreased lung perfusion. In your lungs, you'll have cough with sputum, shortness of breath, and oftentimes pleuritic pain. Sometimes that cough will come with what is called hemoptysis, and that's a bloody sputum. Muscular aches and fatigue, weakness. So in your central nervous system, you can have headaches, loss of appetite, mood swings, irritability. Your blood pressure can drop. Your heart rate will go up, can go up. And oftentimes you can be nausea and or have vomiting. And this is along with joint pain as well. Okay, now the normal and abnormal alveoli in your lungs. This is where you see pneumonia at its heart. This is where it attacks you. So with the normal alveoli, you see a nice clear patent open air sac which allows for good gas and blood exchange and creates the oxygen in your blood system, or it adds the oxygen to your blood. When you have an alveoli that is clogged with pneumonia bacteria or other types of pneumonia-causing pathogens, you see it's the alveoli is filled with fluids or mucus or pus, infection, which prevents air and blood exchange. Okay, now, Module 3. Adult vaccination options and scheduling for pneumonia prevention. So this table here shows what the CDC recommends as the current vaccination schedule. So we see the PCV13 pneumococcal conjugate vaccination. This one is mostly given to children, but it can be given to adults as well. Usually it's done with a combined provider and patient discussion to see if they fit into certain categories of risk. Okay, this could be possibly traveling to areas where vaccinations haven't been done, or working with children who are in maybe a low-income area who don't have vaccinations readily done. So it could be a reason why the PCV13 would be given to an adult. Okay, the PPSV23. This vaccine is usually given after the age of 65 to adults, and this helps protect them against age-related or environmental-related pneumonia causes. Okay, now let's talk about pneumococcal conjugate vaccine, PCV13. Okay, also known as Prevnar on the package labeling. Its mode of action is prevention. The drug interactions that could occur would be things like Zostavax or blood thinners or cortisones. So if you need a whole list of these possible interactions, you can look that up at the cdc.gov website. It's been shown to be approximately 80% effective at preventing pneumonia. For safety concerns, the one thing that stands out is the elements that make up the vaccine could cause an anaphylaxis reaction. So if you are sensitive to certain vaccines, you might want to make sure that the elements that make up this vaccine are not one that you'd be worried about. The average cost is around $188. And of course, the expected outcome is prevention of pneumonia. Okay. Pneumococcal polysaccharide vaccination, the PPSV23, also known as Pneumovax 23, same thing. Its mode of action is for prevention. It has the same drug interaction things that you might want to take consideration for. The efficacy of this one is around 81%, so it's about the same. Anaphylaxis is still the main safety issue. Cost is around $105. And here again, the main purpose and outcome for this is prevention of pneumonia. Okay, on to Module 4. So what lifestyle or environmental factors do you see in adults that possibly might get pneumonia? So first one is age. As we get older, our immune system just is not able to handle infections quite as efficiently. The next thing, environmental factor, or I'm sorry, genetic factor, could be patients who are immunocompromised. These adults could include those with chronic heart, liver, kidney disease, or chronic obstructive lung diseases like emphysema and asthma. These tend to lend people to be more prone to pneumonia. We also see those with diabetes, alcoholism, HIV, even cochlear implants, and those who smoke also have a higher risk of pneumonia. Smoking is a big one. That's a lifestyle factor that people overlook as far as contributing to the possible infection with a pneumonia bacteria. Okay, so on to Module 5. These are the closing activities. This is your summative evaluation quiz. So the first question would be, and what you can do is write these answers down and we'll turn them in. What are the 2 symptoms of pneumonia? So out of the previous part of the lecture, use 2 of those symptoms and write them down. The next question is, what bacteria is most often the cause of community-acquired pneumonia? And the next question would be, explain 2 of the most commonly used vaccines in the United States. to prevent pneumonia. And lastly, from Module 4, name 2 lifestyle factors that increase one's chances of catching pneumonia or contracting pneumonia. With that, I appreciate you spending 15 minutes out of your lunch today as student nurses to learn a little bit more about pneumonia. And I hope that this quick little mini lunch and learn session has taught you some things you didn't know before. So if you have any questions, please refer to the reference list here for more information. You can look things up. The CDC website has a lot of great information on pneumonia, and they always keep it up to date, along with your textbooks. And if you have any questions, don't hesitate to ask. Thank you very much.